Chapter 10, Angina pectoris, which is chest pain, and Myocardial Infarction, which is a heart attack. First, we're going to talk about the heart, and then we'll go into the two topics. So, coronary artery disease, acronym is CAD. The greatest number of deaths in the United States come from coronary artery disease. African Americans, once again, have the highest coronary artery disease mortality rates, followed by non-Hispanic whites. So you can have a sudden chest pain, and that chest pain may be cardiac or non-cardiac in origin. A chest pain of cardiac origin is most often the result of coronary artery disease. All the different causes in some way reduce the flow of oxygenated blood to the heart muscle. So atherosclerosis of coronary arteries is a major cause of CAD. What it does, it's inadequate oxygen to the myocardium. And the myocardium is the muscle around the heart. Myo means muscle, and cardium, of course, is heart. So it's also known as a myocardial ischemia. If it's untreated, coronary artery disease can result in angina pectoris and or in very, very severe cases, an acute myocardial infarction. Infarction is also another word for blockage, like as in a thrombosis or an embolism. Infarction is a blockage, and myo means muscle, of course. Cardial is around the muscle around the heart, and there's a blockage of very serious blockage around the muscle of the heart. So here is, I think this picture helps with the coronary arteries. You have the aorta, which is up here, and you have this aorta, and then you have the coronary arteries which stem from this aorta, and they run all the way down. And these little black spots in here are really great places that they have blockage. All of these would be places that sometimes are blocked by little embolisms. So you could have a blockage somewhere, a little piece flies off and it travels around through and it goes in here until it can't go any further, and then it stops there and is a little bit stuck. So these all originate from the aorta, and they're all on the outside of the heart. So sometimes we take some medicines that can dilate these coronary arteries for people that have this kind of problem, which means they're going to widen these arteries a little bit with medication, and maybe they take blood thinners and it kind of thins the blood out to where they don't have as many blockages. So ischemia is the death or necrosis of tissue due to a lack of oxygen to the tissue. And we've talked about ischemia before. It's like a big white patch almost because it's not getting any oxygen there. The most common cause of ischemic heart disease is atherosclerosis, when you already have the yellow plaques and buildup cholesterol that are already building up into the arteries. So it's a slow inflammatory disease, and it often even starts in childhood. Major cause of all forms of coronary artery disease is atherosclerosis or ischemic heart disease. Here's two pictures which help with remembering all of this. Here is atherosclerosis. This is a normal heart and normal arteries that come out, and you can see this picture right here. It's the normal artery wall and the platelets are coming down, carrying the blood and oxygen and into the coronary arteries. Now here's red blood cells also. This particular blood vessel has atherosclerosis, and they have two buildups opposite of each other. And so these eventually, when this closes, this is all going to back up, and anything on this side of it is not going to get any more red blood cells with oxygen, so these parts would become ischemic, and anything around that. It makes it very narrow artery, and you can see this buildup right here of all these plaques on the outside. This is ischemia, and here there's barely any on a healthy heart. So this is ischemia also, just another, here's the blockage. So blocked lumen is, the opening is a lumen, and the lumen is blocked in a branch on the left coronary artery, and this is an anterior infarct. So it's a very big spot of blockage to where this whole area right here is dying because it's not getting any of the oxygen because of this blockage right here. So risk factors for coronary artery disease is damage to the arterial walls. You can't change, there's things that you can change, there's things that you cannot change in order to make yourself more healthy. One thing you can't change is your gender. Males are more at risk. You can't change your age. There's increasing atherosclerosis as you get older. And your heredity or race, family history. You can't change that. And once again, African Americans would have the highest coronary artery mortality, so death from that. But what you can change is obesity. If you're a type 2 diabetic, you can really do some sacrificing and learning better how to eat better and get off the medications if you're a diabetic. You can increase your physical activity or inactivity. If you're a smoker, you can stop. If you have high blood pressure, if you're over 50 years old with a systolic greater than 140 on a continuous basis, you're at really high risk for damage to the arterial walls and coronary artery disease. And if you have high cholesterol. So here's another picture of atherosclerosis where the walls of the arteries are also becoming stiff and not as pliable, and on this coronary artery, and you have all this plaque buildup around the whole thing, and eventually it can just close up. So angina pectoris is chest pain. Anytime you know people that will eat a big, huge meal and then afterwards they'll feel a little chest pain. That is usually, they have angina pectoris, but it's usually not from cardiac. It's due to other things that we'll get into a little bit later, but it is not usually heart related. So angina pectoris that is heart related is usually an inadequate supply of oxygen to the heart. The primary goal in the treatment is more oxygen. So usually that chest pain, it is painful, and it's usually caused by atherosclerosis, which are the yellowish plaques. They usually do a Levine sign when you have angina pectoris, where you just lift one hand up to the heart, and you can have that kind of pain whether it's cardiac related or non-cardiac related. They can all give the Levine sign, and I would know that. So forms of angina is, of course, the Levine sign. You have stable, unstable, and variant. types. So the stable form of angina is when it's exertional. It's predictable. The pain maybe lasts for 1 to 15 minutes. You take nitroglycerin, it clears up. There's no change in frequency, cause, or duration in the last 60 days. And well, for these people, you would want a short appointment in the afternoon for people who have a stable angina. Incidentally, they would be an ASA2 because it's more stable. If they didn't have anything else going on in their system, they would definitely be an ASA2. If you have unstable angina, that means at rest or very minimal exertion, you have chest pain. And so the pain can last a lot longer. It lasts up to 30 minutes. And nitroglycerin underneath the tongue may not relieve the pain at all. And these people have a very high risk for a heart attack or a myocardial infarction. And it's unstable. It would definitely push them into an ASA3 category on their health. So then you have variant. This is Prince metals. Prince metals, I remember that on my boards, Prince metals. It occurs spontaneously while you're at rest or at just really odd times of the day or night. It's more common in women under 50, which is surprising. And nitroglycerin definitely relieves that pain. So those are the 3 types and the 3 forms of angina. This is a blood pressure classification. You will notice on most of them that this is what they will say. If you ask someone what their blood pressure is, they will say, if you say, what is 120/80? They'll say that's normal. When in fact, if you start really looking at the signs on these classifications, you will discover that they all say less than. So I'll go over this little bit of what's less than and greater than. Some people get these confused after they're out of school for a while. So you always read from left to right. On the less than, this is less space. These 2 lines are touching. So this is less, so you say less than. So it's less than this. Okay, this is a wide opening. This is not a wide opening. It's not an opening at all. So it's less than 120 and less than 80. Or down here, you have a greater than. You're always going to start on the left side in front of the mathematical symbol. This is greater space in here than this is. So it's greater than this. Greater space than this. So this is greater than or equal to 160 or greater than or equal to 100. So actually, if you get a question on a board, they're funny about this. Sometimes they'll call 120/80 normal. I've never seen a question that has said, choose the normal blood pressure in the following multiple choice questions. And they would have, 120/80, less than 120/80, or like 119/79. Which one is it? They'll have either one of the, they either have 120/80 and then a bunch of different obscure numbers, or they'll say 119/79. And technically, that's the truer one. So just want to make that note to you. When you're prehypertensive, that's when you start going 120 and over. So if you're 121/82, you're in a prehypertensive state. And these always, like I said before, this is a difference of 19. I don't know if I can draw that. 19, and these are a difference of 9. So it's almost 20 and almost 10. So this would go 120 to 139, because at 20 difference, it would be 140. So it's just one less. This is 9 difference, and I say less than 10, it would be 80 to 90 would be 10 difference, 90 to 100 would be 10 difference, and this is just a little less. So there's 9 on the diastolic, and there is almost 20, 19 being exact, on the systolic. Once again, then it will start with 140. You'll go almost 20 more to a 19. If they have any blood pressure systolic between these numbers and diastolic between these numbers, then they are stage 1 hypertensive. Stage 2 is anything greater or equal to 160. So if they have 160 over 100, they are definitely a stage 2 hypertension, just based on their blood pressure alone, not on anything else going on. So treatment of angina, you terminate your treatment if they have a big chest pain, semi-supine or upright position. You're going to assess and always do the CABs, basic life support, monitor their vital signs, possibly give them oxygen if they need it, and definitely give them some nitroglycerin underneath their tongue. Most medical kits do have nitroglycerin, and this form happens to be in a spray. And usually if they have these kind of issues, they will have nitroglycerin with them. They will know it. And it's always better to let them, once again, take their own. It's more apt to be not be out of date. So they'll feel tingling sensation on the tongue if it's really fresh nitroglycerin. They're going to administer 1 tablet sublingual underneath the tongue or mucosal, like in the cheek, every 5 minutes, and up to 3 doses in 15 minutes. So they shouldn't have over 3 doses every 5 minutes. This usually alleviates the symptoms in about 2 to 4 minutes. So they may not need 3 doses. It may be just that first dose did the trick. But if it's not doing the trick, then you want to give them another dose 5 minutes later, and then another dose 5 minutes later. So nitroglycerin is what can dilate the coronary arteries that we were talking about that surround the heart when they get blockage. This is going to dilate those coronary arteries, and that's what's so helpful about it. Nitro is contraindicated, though, in hypotensive patients if they have a systolic of less than 100. So if their systolic is 90 or 80, 70, 60, you don't want to give nitro, because if nitro is going to dilate the coronary arteries, it also means that it's going to lower, when those arteries dilate, it lowers your blood pressure. So if you have someone that's already, once again, hypotensive, which means they have it's lower blood pressure than normal, then you don't want to give them nitro, which is going to lower it even more and maybe put them into a dangerous place. So if the pain continues or returns after it has subsided, whether it's 1 dose or 3 doses, then you're probably looking at an acute myocardial infarction, which is a heart attack. So the EMS should be contacted immediately if the patient states that the symptoms are more severe than usual. If the chest pain occurs on a patient and they have no known anginal history, then you're going to administer 1 dose of nitro and contact EMS immediately, because they know if someone with a familial history of angina issues, there's a pattern there, and they seem to come out of it. And so you may want to contact EMS, but first you try these doses of nitro. Someone that has no history, this is coming out of the blue, they could have a blockage, who knows what they have. So you want to contact EMS immediately. And the steps for treatment of a known anginal patient should be followed. So the primary goal in treatment is to decrease the heart muscles' demand for oxygen. Okay, so that's our primary goal. So acute myocardial infarction, or AMI. There's a necrosis of a portion of the heart muscle or myocardium due to total or partial occlusion, which is closure, of a coronary artery. So around it, it's going to necrose or die. Necrosis is like tissue death. So caused by atherosclerosis, which are the plaques in the arteries, a thrombus, which is the originating blood clot, or some type of a spasm resulting in a lack of oxygen. So this is a heart attack. This is reversible. Consider this to be a quiz or midterm final question, and definitely it could be a board's question, because some of these things are not reversible once you get them, but a heart attack is reversible, and you know that to be true. If you get this question and are wondering if it's reversible, because immediately you're going to think of all the people that die from a heart attack when you're answering a question, like, and you're nervous, and like maybe you're taking boards or a test. But you've got to also remember how many people that you've read about and seen in movies, etc., who have had a heart attack and survived. So many people can survive heart attacks. So it is a reversible pathological heart condition. It may form rapidly over a period of time, rapidly or over a period of time, very slowly, but it can definitely lead to cardiac arrest. So we need to, of course, pay major attention to that. Cardiac dysrhythmia. Arrhythmia is the rhythm of the, the beat of your pulse. This is talking about the heart, how your heart pumps. So the heart pumps in a way of, I'm really bad at sound effects, but I'm going to have to continue in this since I'm not standing before you. A rhythm of the heart will go in like bum 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 bum. That's how the heart pumps. So the rhythm goes that way, and that's a normal. So cardiac dysrhythmia, it's difficult. It's like not, the rhythm is not correct. They're having a problem with it. It could be going pump, 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 pump. It's all out of whack. So that would be cardiac dysrhythmia, and that can occur within 2 hours after someone has a heart attack and survives the heart attack. And that cardiac dysrhythmia 2 hours after a heart attack is the greatest risk for death. Signs and symptoms. Classic symptom is a chest pain lasting 20 minutes or longer. So all of these TV programs where the person does the Levine sign and grabs, puts their hand up to their heart and says, ah, like this, and just drops on the floor, is just movie making. Because usually if a person is having a heart attack, that chest pain is going to last longer than just all of a sudden having this sharp pain and then dropping 2 seconds later. Chest pain needs to last at least 20 minutes or longer. If you have something that you have a chest pain that is super sharp, that's more likely to be gas, or it could be indigestion, something like that, over something that you've eaten. So that usually is really a sharp pain and doesn't last very long. And so it might kind of come back and take a little while to subside, but it's not this constant chest pain lasting a long time. The patient will feel pressure, tightness, heaviness, burning, could feel a squeezing or crushing sensation in the middle of their chest. The pain may radiate down the arms and shoulders, and especially on women, it could be the jaw or the back of the neck. So we need to watch out for those symptoms. They could have weakness, dyspnea, which means difficulty breathing, diaphoresis, there could be sweating, irregular pulse, they could be nauseous, they could start to vomit, they could have this really sense of impending doom and clutching of the chest, which is the Levine sign. Women show a little different symptoms. They have atypical, which is not typical, comfort. They have discomfort that's not very typical, which is what that means. Upper abdominal pain, shortness of breath, and fatigue. Diabetics also can suffer silent MIs. They get so used to how they're feeling over diabetes that they could have very silent heart attacks. Treatment, you're always going to terminate the procedure. If there's no history of angina, like we said before, contact EMS immediately. Position the patient comfortably, probably upright or semi-supine, and assess the CABs of basic life support. So if they're having any trouble breathing, you especially want them upright or semi-supine. So if they are having trouble with that breathing, you may want to administer some light oxygen through a nasal cannula. Always monitor their vital signs about every 5 minutes. You want to take that down and document it and give it to the EMS people when they arrive. Administer nitroglycerin from your emergency card. Once again, 3 doses over a 15-minute period if they need it. So administer aspirin. It's better for them to chew the aspirin to get into their system a lot faster. That would be 325 milligrams, which would be 4 baby aspirin at 81 apiece. And like I said before, 81 times 4 baby aspirin would actually be 324, but they always put it as 325. But a baby aspirin has an antithrombotic effect. This might be on one of your midterms or finals that will say antithrombotic or a thrombotic effect. A thrombosis is a blood clot, remember. It's the original blood clot. So if you take an aspirin, which thins the blood, it's antithrombotic. So it would be help the blood clot dissipate because it's going to thin the blood. The clinical effect is reached in about 20 minutes. So it's not an immediate relief. It takes about 20 minutes. You can manage their pain, nitrous oxide, if that's available and if they would be a recipient of nitrous oxide. And you always have your AED there and at least know where it is in your office and in our school. Once again, it's on the 1st floor hallway and on the 4th floor in the stairwell on the wall. So if the cardiac arrest occurs, you are going to perform CPR with an AED. It's out of the hospital heart attack victims should begin fibrinolysis, which is when you see that word fibrinolysis, sorry, I can't speak. Fibrinolysis means with an aspirin. So it's a breakdown of a clot by an aspirin. So you should begin that as soon as the symptoms are recognized. And this would be a person that maybe you would be, you'd be out on the street. They're not in the hospital. They're not near any kind of help. You would want to begin, and you know for sure this is a heart attack. You would want to begin aspirin or fibrinolysis to try to break down that clot right away. 162, which does, if you take 81 times 2 baby aspirin, it does equal 162 milligrams. And you have the 4 baby aspirin, which does not equal 325, but that's what they use, of acetylsalicylic acid. So this is baby aspirin is for anticoagulation, and you can see here, right here, it's going to say 81. Some of them say 0.81. Just get rid of the point and times it by 4, and it does need to be chewable. Non-cardiac. Let's talk just a little bit at the end of this about non-cardiac. Non-cardiac, like I said before, is more localized in nature. It isn't like generalized all over the chest. It may be in a certain spot or two around the chest. It's that stabbing knife-like pain that they show in the movies, where all of a sudden they just feel this knife-like pain and put their hand up again, like a Levine sign, and it's aggravated by movement and breathing, which is mainly what's showing in the movies. Sometimes the person that has this, you don't want to move. If you're standing, you just kind of put your arms on something and hopefully kind of breathe deep and wait for that pain to go away, because everything is aggravating the pain on that. The chest pain usually lasts less than 30 seconds. Seems like it lasts a lot longer when you're the one that's having it, but it usually only lasts that long. So that would be the non-cardiac type. And that would be it to angina pectoris and myocardial infarction.